Narcotic abuse. It's a serious and growing problem in the U.S., and so far, efforts to make drugs like oxycodone and hydrocodone abuse-deterrent have proven ineffective in the fight against abuse. Such was the case with OxyContin and the subsequent rise in heroin use.
The prototypical case here is OxyContin, which was the poster child of drug abuse for many years because it contained a very high dose of oxycodone, which is the drug found in Percocet. And although Purdue Pharma tried to make it time release, which is good since it gives a steadier state of the narcotic in the blood of the people that need it, addicts found that they could grind up the pill and get between either 40 or even sometimes 80 milligrams of oxycodone, which is a huge dose. So they started snorting it and smoking it, and addiction obviously took off. By 2010, Purdue came up with an abuse-proof formulation, which made OxyContin very, very difficult to abuse, and it worked. But the unintended consequences were that people who are already addicted are going to still be addicted. They're not going to stop because OxyContin doesn't work anymore. So you can see an obvious switch in abuse from oxycodone over to heroin.
The law has made it more difficult for those in legitimate pain to access painkillers and quickly. In 2014, the Drug Enforcement Administration reclassified hydrocodone, the narcotic found in Vicodin, as a Schedule II drug, the most restrictive class of all legal drugs. The reclassification means physicians can no longer call or fax in prescriptions, nor could they order refills for patients in immediate need.
The doctor cannot call on the prescription anymore. The doctor cannot write for a refill, and 90-day supply is the maximum that can be prescribed. So you actually have to physically obtain the prescription from your doctor, even if you're in chronic severe pain or terminal stages of cancer. And sometimes in rural areas, people have to drive hundreds of miles even to see a doctor. So I think these are restrictions that are punishing patients in need in the attempt to crack down on narcotic abuse.
You can read more about this issue on our website at aksha.org, and don't forget while you're there to also sign up for your daily dose of news delivered straight to your inbox.